Good evening everyone. Today we will be discussing about the topic of Palsy. So first when we discuss a topic we have to know what the topic literally means. So palsy means weakness or loss of voluntary movements in a muscle or a group of muscle probably due to nerve damage. And URBS because it was discovered by Wilhelm Heinrich Erb who was a German neurologist and he discovered this condition in the 19th century. So, what causes of palsy? Excessive increase in the angle between shoulder and head due to forceps delivery injury, breech delivery injury while birth, and it may also be acquired due to trauma while falling from back of a horse or any animal and landing on your shoulder. So, when you come up with this, you have to know what it actually looks like to be able to diagnose and to be able to recognize this condition. So, in this, and why is it called policeman's tip? Why is it called so? Because when you get arrested, this is your position while you get your handcuffed on. And so there is adduction and medial rotation of your arm. That is adduction and medial rotation of your arm, which is due to the paralysis of deltoid and supraspinatus and infraspinatus group of muscles. And as you can also see, there is extension of my elbow and pronation of my forearm, which is due to paralysis of biceps brachii. So, what are the nerve roots involved in this? That is C5, C6, the upper trunk. Upper trunk of what? And what is this related to? And to understand this, you have to know what brachial plexus means. Brachial plexus, the word brachial is associated with arm or the structures related to the arm, and plexus is a network of intersecting nerves, blood vessels, or limb vessels. But here we will be restricting ourselves to nerves itself. So this is a schematic diagram of the brachial plexus, which consists of roots, trunks, divisions, cords, and last but not the least, branches. So the problem lies in the C5 and the C6 nerve roots and the upper trunk. So what are all the muscles involved? All the muscles involved in this URBS palsy? We can easily remember this by a mnemonic: damn sick injured boys become badly sad. D for deltoids, S for supraspinatus, I for infraspinatus, B for biceps brachii, B for brachioradialis, B for brachialis, and S for supinator. So now you might be thinking or asking that there is motor involvement. What about the sensory involvement as well? Okay, so now at times there can be sensory involvement as well, which is along the outer aspect of the arm. Sometimes, as I clearly said earlier, due to the involvement of the C6 nerve root. Now there is another point which examiners might ask: what is URBS point? He himself also discovered this point. URBS point is a point where 6 nerves meet, that is C5 and C6 nerve root, suprascapular nerve to subclavius, and anterior and posterior divisions of the upper trunk. All these 6 nerves meet together at the point which is known as the URBS point. So, and from this URBS palsy topic, the main things that are to be remembered are the nerve roots involved, are the muscles involved, definitely the causes, and the URBS point. All these are to be remembered clearly to be able to get good marks while you are being asked by an examiner. Okay, so this covers the whole topic of URBS palsy. Thank you and have a nice day.